Welcome. My name is Peter Strong. I'm a professional psychotherapist based in Colorado, and I offer online Skype counseling therapy for anxiety and depression and other emotional problems that benefit from mindfulness therapy. I specialize in mindfulness therapy. This is a system of psychotherapy that I developed many years ago now and find to be very effective for working with anxiety and depression. So online therapy is an excellent option, and especially if you use Skype, because then you can see each other, and being able to see each other makes communication better and allows you to learn the nuances and details that you might miss if you try to do online therapy via email or some form of online chat format. You really need to see each other, and that's what Skype makes possible. It's a wonderful service that allows you to connect with another person anywhere in the world. I work with many clients abroad in the UK and Europe and as far away as Korea and Japan, even Australia. All you need is a good internet connection, and then you can have a Skype therapy session at a time that works for you. So Skype counseling, it describes the process of really learning different ways of working with your emotions, of seeing things differently, of getting advice and help in putting things in perspective. It's basically the same as traditional talk therapy. It has usefulness, always to be able to talk to someone else who has experience working with anxiety and depression. It's useful. But what I really recommend is some form of psychotherapy. So Skype therapy really is designed to help you heal those underlying emotions that are causing your anxiety or depression. It teaches you practical methods of healing so that your recovery process is faster than it would be just talking about your emotional problems. So really the combination of Skype counseling and Skype therapy is really optimal. So mindfulness therapy is what really excites me, and I find to be really effective, and most people really enjoy. It's a way of fundamentally changing the way that you relate to your anxiety and depression. Most people have a very poor relationship with their emotions. They really dislike their emotions, and they try to escape emotional pain in particular. But if you make a problem out of your anxiety and depression, that will simply feed the anxiety or depression. What really we need to do here is change our relationship from an adversarial relationship to one that is based on friendliness and compassion. These are hallmarks of mindfulness, of course. You need to really treat your emotions like children. See them as objects in the mind that are in pain and that are trying to heal and are trying to get your attention to help them heal. That's a much more constructive way to work with your emotions than seeing them as being problems that need to be fixed or controlled or medicated. Medication is not a very effective way of working with anxiety or depression because it simply does not heal the underlying psychological cause. It simply covers up the symptoms and provides a temporary relief. Well, that's not sufficient. So in mindfulness therapy, we really go to the heart of the problem. We learn how to change our relationship totally to our mind and to our thoughts and beliefs and memories. So we do this by the methods of mindfulness meditation as I teach it. We learn to meditate on our emotions and on our memories and thoughts. We're not trying to exclude them. We're trying to actually learn more about how they work, to see the internal patterns of habitual reactive thinking and rumination that feed your anxiety or depression. We also need to develop this internal bond that I call the true self, little self alliance. So your true self is really that higher part of your conscious mind that's able to be the observer, that is able to see your emotions without becoming identified with them and without becoming consumed by them. It's able to see them in the same way that a parent can see a child that's maybe in pain and that needs help. It's the same kind of relationship we need to establish internally. This alliance between your true self and your little self, the emotions, is what really leads to profound healing internally, and is much, much more effective in the long run than any amount of medication or strategies to try and cope with anxiety and depression, or distract yourself from your emotional pain. So we build this relationship by meditating on our emotions. Most people think that meditation means trying to get out of the mind, to create a more pleasant place, a retreat from the thoughts and the emotional suffering and the chaos of the mind. But that's not true. Meditation is not an escape from suffering. It's supposed to be a way of turning your attention towards that suffering in order to facilitate healing. The purpose of meditation should be to heal the mind, not to try and escape it. Really, that's the whole function of emotional suffering too. Suffering is actually the mind's way of showing you where you need to direct your attention. It's like physical pain. It has a function. It's very functional. Suffering is not a problem. It is the mind's way of intelligently directing you to those areas of the mind and your habits that need more conscious awareness, that need to change. So we learn to listen to our suffering and respond to it by bringing lots of conscious awareness to those thoughts and beliefs and traumatic memories and emotions that need our help. So that is the process of meditation. The mechanism of how we do this, I will teach you in great detail, of course, during our sessions together. But basically, the most important thing to do is to start changing your relationship from one of aversion and avoidance to one based on friendliness and compassion. You need to develop a compassionate relationship internally with your emotional pain. That is what allows healing. That is the first step that promotes healing. It's the necessary condition for healing. And that is a primary focus in mindfulness therapy. There are lots and lots of other components to mindfulness therapy and mindfulness meditation on emotions to promote healing. And I will teach you all about this during our sessions together if you are really interested in overcoming the root causes of your anxiety and depression. So if you'd like to learn more, please contact me and let's schedule a Skype therapy session. Most people really enjoy online therapy. It's much more comfortable for you, and mindfulness therapy works extremely well online, and most people see tremendous benefits within the first few sessions. The reason why mindfulness therapy works so well is because it focuses very directly on your emotions and the thought patterns that feed those emotions. And it allows you to re-establish balance and re-establish this internal compassionate relationship that promotes healing. So if you'd like to learn more, please contact me and let's schedule some Skype therapy sessions so you can see for yourself. All my sessions are basically satisfaction based. That means that if you do not find the sessions useful, there is no fee, no charge. You only pay if you find that each session is achieving a useful result for you and that you are seeing benefits. I feel that's very important, and I would strongly recommend that you never work with any therapist unless it's based on a results or satisfaction basis. You should see results within a few sessions, and that's really the main focus here. My job is to help you heal, and not just to establish an endless relationship that doesn't really change anything, which I see too much in the field of psychotherapy and counseling. At any rate, if you'd like to schedule a session with me, then please go to my website and contact me through the contact page, and then we can set up a session at a time that works for you. Thank you.